Stop whatever you are doing right now and look at your fingernails. I mean, really look at them. Do you see those thin lines running from the base of your nail all the way up to the tip? Those vertical ridges that you have probably been ignoring for months, maybe even years, thinking they are just a cosmetic thing, just a beauty problem? I need you to listen very carefully, because what I'm about to tell you could genuinely change how you think about your health. Those little lines on your nails are not random. They are not just aging. And for some people watching this right now, they are your body's quiet way of screaming for help. Stay with me, because by the end of this video, you will never look at your nails the same way again. Hi, I am Dr. Emily Walker, and on this channel, I break down complex medical science into simple, honest, and actionable information so you can take better care of your body. Today, we are going deep into something almost every single person has, but almost nobody fully understands: vertical nail ridges. And trust me, what I am about to share with you is going to surprise you. So let us start with the basics. Your nails grow from something called the nail matrix, which is the living tissue hidden underneath the base of your nail, right where you see that little half-moon shape. Now, this matrix is incredibly sensitive. It responds to everything happening inside your body: your nutrition, your hormones, your circulation, even your stress levels. Every single nail you grow is essentially a health diary. The nail grows about 3 to 4 millimeters per month, which means by the time you see something wrong on the surface of your nail, that problem may have started weeks or even months ago inside your body. Now, vertical ridges, which doctors call onychorexis, are lines that run lengthwise along the nail from the cuticle to the tip. And here's the first thing I need you to understand. Not all vertical ridges mean the same thing. There is a spectrum here, and knowing where you fall on that spectrum could genuinely matter for your health. The most common cause of vertical ridges is simply aging. As we get older, the nail matrix produces cells less efficiently. Think of it like an old printer that starts leaving streaky lines because the ink cartridge is not flowing as smoothly as it once did. The natural oils and moisture in the nail bed decrease over time, and the result is those visible ridges. Research published in the Journal of the American Academy of Dermatology confirms that vertical nail ridges become significantly more pronounced after the age of 50. So if you are older and you have mild ridges and you feel completely fine otherwise, this alone is likely the culprit. But here is the thing: aging alone does not fully explain what is happening in millions of younger people. And this is where it gets really interesting. One of the most overlooked causes of vertical nail ridges in people under 50 is nutritional deficiency, and I cannot stress this enough. Your nail matrix requires a steady, consistent supply of specific nutrients to produce smooth, strong nails. The most common deficiencies I see associated with pronounced nail ridges are iron, zinc, B12, and biotin. Iron deficiency, in particular, is something you need to pay attention to. A study published in the Indian Dermatology Online Journal found that patients with iron deficiency anemia showed significant nail abnormalities, including ridging, brittleness, and what is called koilonychia, which is when the nails actually start to curve inward like a spoon. Now, when your iron is low, your blood carries less oxygen, and your nail matrix, which is one of the first tissues to suffer when oxygen delivery drops, starts producing irregular cells. Those irregular cells show up as ridges on the surface of your nail. Zinc deficiency is another big one. Zinc is critical for cell division and protein synthesis, and your nails are essentially made of a protein called keratin. Without enough zinc, the keratin formation process becomes disrupted and uneven. Studies estimate that up to 2 billion people worldwide may be zinc deficient, and many of them have no idea. They are eating every day, they feel reasonably okay, but their body is quietly running on empty when it comes to this essential mineral. Now, I want to talk about something that is going to surprise a lot of you, because when most people think about nail problems, they think about nutrition or skin conditions. But did you know that vertical nail ridges can sometimes be one of the earliest external signals of an autoimmune condition? Conditions like rheumatoid arthritis, lupus, and even lichen planus, a condition where your own immune system attacks the skin and nails, can all show up first on your nails before the more classic symptoms appear. In fact, in some cases, nail changes precede joint pain and inflammation by months. Your nails may be waving a red flag while your immune system is already starting a war inside your body that you have not yet felt. This is why dermatologists and rheumatologists both pay close attention to nail morphology during examinations. Here is another surprising fact I want to share with you. Chronic psychological stress and trauma do not just affect your mental health, they physically alter how your nails grow. When you experience prolonged stress, your body releases excess cortisol, which constricts blood vessels and reduces blood flow to peripheral tissues like your nails. Poor circulation to the nail matrix means less oxygen, less nutrient delivery, and more irregular cell production. There is even a phenomenon called Bowes lines. These are horizontal grooves, not vertical. But the mechanism is similar and teaches us something important. Your emotional and physical stress registers in your nails like a seismograph registers an earthquake. Your body keeps score, and your nails are part of the scoreboard. Thyroid dysfunction is another cause that I see underdiagnosed in connection with nail changes. Your thyroid hormones regulate the rate of cell turnover throughout your body, including in your nail matrix. When thyroid hormone levels are off, whether too high or too low, nail texture and growth patterns change. Hypothyroidism in particular is associated with brittle, ridged nails, alongside other subtle symptoms, like fatigue, hair thinning, and feeling cold all the time. If you have vertical ridges along with any of those symptoms, please talk to your doctor about getting a thyroid panel done. Now, I want to be responsible here and tell you clearly, the vast majority of people with vertical nail ridges do not have a serious underlying disease. Most cases are a combination of aging, mild nutritional insufficiency, and lifestyle factors like dehydration and frequent exposure to water, soaps, and chemicals that strip the nail of its natural moisture. But the key is knowing the difference between normal ridging and something that warrants a conversation with your doctor. So how do you know when to be concerned? Here are the signals that should prompt you to get checked. If your ridges are deepening or worsening rapidly over a short period of time, if the ridges are accompanied by nail discoloration, yellowing, white spots, or a bluish tint, if you have ridges along with unexplained fatigue, joint pain, hair loss, or other systemic symptoms, if the ridges are splitting the nail at the tip or causing the nail to peel or crumble, these combinations of symptoms are your body asking for more than a vitamin. They deserve proper medical evaluation. Now let us talk about what you can actually do about this. The most powerful and accessible starting point is nutrition. Getting enough iron from sources like lean red meat, lentils, spinach, and fortified cereals makes a real difference. Pair iron-rich foods with vitamin C to boost absorption. A squeeze of lemon over your lentil soup is a simple, effective habit. For zinc, focus on foods like pumpkin seeds, chickpeas, cashews, and whole grains. For B12, animal products are your primary source: meat, eggs, dairy. And if you follow a plant-based diet, supplementation is almost certainly necessary. Biotin, which you will see marketed heavily for hair and nail health, can also help with brittle-ridged nails, though the evidence is strongest for people who have a genuine deficiency. Hydration matters more than most people realize when it comes to nail health. Chronically dehydrated nails become brittle and ridge more easily. Aim for adequate water intake daily and consider wearing gloves when your hands are frequently in water or cleaning products. Massaging a small amount of natural oil, like jojoba oil or vitamin E oil, into your cuticles regularly helps keep the nail matrix hydrated and supports smoother growth over time. And please, do not ignore persistent, abnormal nail changes. Your nails are not just there to look good. They are a biological window into what is happening inside your body. Throughout history, physicians have used nail examination as a diagnostic tool, and modern medicine continues to validate that practice. A simple blood panel checking your iron levels, ferritin, B12, zinc, and thyroid function can answer a lot of questions and give you and your doctor a clear picture of what your body needs. Here's my final thought for you today. We live in a world that tells us to focus on the dramatic symptoms, the chest pain, the obvious illness, the undeniable sign that something is wrong. But your body is constantly communicating with you in quiet, subtle ways long before a crisis develops. Those vertical ridges on your nails might be nothing, or they might be your body's early warning system doing exactly what it is designed to do, giving you time to act, to adjust, to pay attention. And the fact that you are here, watching this video, asking these questions, means you are already ahead. You are listening to your body. That is the most powerful form of preventive healthcare there is. If this video helped you understand your body a little better today, please give it a thumbs up. It genuinely helps this channel reach more people who need this information. If you have questions or you want to share what you noticed about your own nails, drop a comment below. I read every single one. And if you are not subscribed yet, hit that subscribe button and the bell icon so you never miss a video, because every week I bring you honest, science-backed health information that your doctor might not always have time to explain. Next week, I am covering another health signal hiding in plain sight on your body that most people completely overlook. Trust me, you do not want to miss it. Take care of your body. It is the only one you have got. I will see you in the next video.